What's going on, everybody? So we've talked to a lot of our athletes about having tight ankles and how it could really limit our squat, and it can even get us injured if we don't take care of it. Number one, if we have tight ankles and we're compensating in our squat and we're having to lean forward, we're having to get that chest to the floor during a squat, it could lead to knee problems. And if you have to squat with that exaggerated hips back position, that could lead to back problems. So what I'm going to do is I'm going to test for my ankle mobility here first, and I'll show you how to do that. So what I want you to do is, you can try this at home or whatever, I want you to place a fist and a thumb away from a wall or some type of structure. And then what you're going to do is you're going to see if you could drive your knee forward and touch that. That's about good range of motion. And this left ankle of mine, very healthy, I could do that. My right ankle, not so much since I sprained it. Now, I want you to look for two things here. If you feel a tightness in here, this is going to be a joint problem. If you feel like this is really stretching in the calf and the Achilles, what that probably is a soft tissue issue. So, if it's in the back of your calf, what I want you to do is you need to work that tissue out, and we need to do some type of rolling or some type of soft tissue release, especially for the calf. I like to get it on a foam roller or even a bar if I want to concentrate that breaking up of that issue, softening it up so that it can lengthen better, okay? So you can either do this on a PVC or on a lacrosse ball on a bar, like as you see here. And then, if it's in the joint, we don't have such an easy solution, but there are solutions that we could work on a little bit here, okay? The first and the best one that you could do is with a band. So I have this band fixed back here. This band, I'm gonna work forward, I'm gonna get a lot of tension on it, and I'm gonna put this band on my talus joint here, on my talus bone rather. It's really low on the ankle, not up here on the shin, on the tibia. It's low here on the ankle, and I'm gonna allow that to pull the talus back underneath the tibia, and I'm going to then work, that knee forward, allowing that tibia to slide over the talus, and it should relieve that pinching pain that you're feeling, and it'll give you some more of that range of motion. Make sure here that you're not bringing your heel up. The foot needs to be flat, okay? And I could drive my knee forward, I could drive it out a little bit, searching for an impingement feeling, and again, applying the tension from the band and trying to work that tissue. So that's gonna be one way that I could do it. And then another way is just using a weight such as a kettlebell, as a plate, something like that, okay? We're gonna get it on top of our knee, rather in a squat position, okay? And I'm just gonna try to push a little bit gently. I'm gonna wanna work that shin to the floor, trying to increase that ankle mobility and that angle, that shank angle that they call that, okay, here, and improve the mobility. All right, hopefully this helps out, guys. Let us know. Good luck.